The use of plasma-rich growth factors and hydroxyapatite-based scaffold in treating dental bone regeneration by Krista Costellari. Hello, this project proposal is about the combination of plasma-rich growth factors with hydroxyapatite-based scaffold in treating the dental bone regeneration. The combination of PRGF growth factor and the hydroxyapatite scaffold aim in promoting faster tissue healing, enhance bone regeneration, and improve the aesthetic appearance of the affected area. A little background on the issue. Bone regeneration is a procedure that uses other bone as a scaffold to grow new bone in weak jawbone areas. This is very necessary because when the patient no longer has tooth roots that will secure a portion of the jaw, that bone will begin to deteriorate and cause various problems and health issues to the patient. The existing treatments of bone regenerations are a socket graft, a ridge graft, and the sinus graft. A socket graft is done after a tooth extraction to repair the remaining socket. Bone material is inserted to stimulate new growth, support potential implant placement. A ridge graft aims to rebuild the ridge behind the front teeth in the roof of a patient's mouth after tooth removal. The sinus graft thickens this bone wall to support the dental implant in the bone and the sinus cavity where the tooth was removed. The picture illustrates the process of teeth bone grafting and how important it is in teeth implanting by maintaining the bone shape and structure. For this research, I am introducing a new grafting injection that will combine plasma-rich growth factor with hydroxyapatite scaffold. So let's talk first about the plasma-rich growth factors and how they are created. So PRGF is created of patient sample blood. The blood is placed into a centrifuge, which will isolate the patient's plasma. Then the plasma is placed into another centrifuge, where it is enriched with the patient's own growth factor hormones. These growth factors are mixed with graft materials to promote faster healing for the patient. It will be used to coat the implant post before it is placed in the jaw. The figure 2 illustrates the process of centrifuging the patient's blood to create PRGF. The yellow part indicates the blood plasma. The PRGF solution will be mixed with hydroxyapatite-based scaffold. But what is this scaffold? So this scaffold mimics the mineral composition of bone vertebrates. It promotes adhesion and proliferation of osteoblastic cells on the prosthetic surface and allows biological fixation between bone tissue and implant. How it is prepared. The AJ scaffold is created by mixing calcium chloride, magnesium chloride, strontium chloride, and phosphoric acid in a ratio of 1:6. The mixture will be sonicated, and then phosphoric acid will be added to maintain a pH above 10, and then sonicated again. After overnight standing, the solution will be filtered, dried, and exposed to high temperature for a 5-hour hold. The injection with the mixture will be tested through mechanical tests, antibacterial tests, and biocompatibility tests. These test results will be very important for us to determine the compatibility of the injection with the natural tissue. It will distinguish if there is any bacterial infection and will evaluate the interaction of injection with living tissues to ensure that it is safe to use dental applications. And then conclusions of this research is that the PRGF growth factors accelerate the natural healing process by stimulating cell proliferation and promote efficient bone regeneration. Its biocompatibility in being derived from the patient's own blood will lower the risk of getting infection. Hydroxyapatite scaffold mimics the natural bone composition. It serves as a scaffold that supports the attachment of bone-forming cells and contributes to structural stability. The combination of PRGF and hydroxyapatite will create this new injection. This injection will be a good combination approach to bone regeneration, addressing both the biological and structural aspect for bone and tissue healing. And these are the references. Thank you so much for listening.